Welcome back, beautiful tri-state area. You're listening to a moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in our Going Deep segment, brought to you by CO2Lift, today we're featuring Dr. Ava Shamban. She's an American celebrity dermatologist who has made numerous appearances on TV and cosmetic publications as an authority on the subject. She is currently a board certified dermatologist based in LA and founder of Ava MD. She's a member of the ASDS and the AAD. She also serves on the editorial board for the Journal of Clinical and Aesthetic Dermatology. She lectures internationally and serves as a principal investigator on many clinical and FDA trials. She's the author of Heal Your Skin and a regular contributor on the Doctors and Extreme Makeover. Today, she joins me to chat skincare, post-procedure and combination treatments, why pre-prepping the skin prior to a procedure matters, and we'll also get her take on the newest and latest trend of carboxytherapy for incredible skin rejuvenation. Now, a one-size-fits-all approach, whether it's for anti-aging treatments or body contouring treatments, is no longer the norm. In fact, most clients often want to correct the combination of concerns ranging from wrinkles and saggy skin and unwanted fat to sunspots, veins, and hollows from lost collagen. No one treatment can provide a client with a solution for multiple concerns. For example, a dermal filler is an excellent solution for treating volume loss, but it's not going to improve the appearance of sunspots, right? Kybella is going to reduce unwanted chin fat, but it's not going to improve saggy skin. So, what is there to do? Since utilizing only one mode of treatment may not address all signs of aging, the solution is combination therapy. And this approach makes the possibilities simply endless and the results dramatic. And the combination of treatment can be customized to address your specific concerns. Today, the amazing doctor joins me to chat combo therapy, why no single solo method is an effective approach to skincare, and the newest trend of carbon dioxide therapy for the skin. Welcoming now to the show is my expert at hand on expert on the microphone, Dr. Ava Shamban. Welcome, superstar.
Thank you so much. Like, what an intro. I love that.
Well,
and it's
we got to speak your language. Now, I'm going to shift the narrative just a little bit right now to carbon dioxide therapy for the skin. So, I was reading an interesting study directly off of their website, and CO2 is used alone or in conjunction with other procedures. But CO2 lift increased skin hydration by more than 117% compared to baseline. And with these improvements, really, it said lasting up to 3 weeks. So, the physiological effects also include increases in tissue oxygenation, flow rate, and vasodilation, uh, neoangiogenesis of the skin. So, my question to you right now is carboxytherapy seems to be a top trending skincare in the search engine of Google and often compared to a hyperbaric oxygen chamber. Could you elaborate on what carboxytherapy is and why it has gained such popularity?
absolutely carboxytherapy is one of our newest device. In a way, it's actually just a mask, but it's one of our newest tricks and procedures that really delivers results. So carboxytherapy can be used on its own. It's a mask. It almost kind of looks like silly putty. You mix up two little packets together to activate it. And the way it works is you apply it to the face, the neck, the décolletage. We use it all the time immediately following treatment because it accelerates healing and improves results. But it can also just be used at home before you walk the red carpet. Anyway, so the way it works is it delivers CO2 to the skin, which makes the skin a little bit more acidic. The oxygen pops off of the hemoglobin, so you get an internal increased level of oxygen. What that does is it opens the vessels, you get delivery of healing factors, and we see improvements in hydration and glow of the skin, and just overall improvement in the appearance of the skin. So, as I said, because you're getting very similar to a hyperbaric oxygen treatment, it will accelerate healing, give you more hydration, and is incredibly useful for just improving the appearance of the skin, whatever area of the skin you apply it to.
The positive effects of invasive carboxytherapy are scientifically explained. You said it. You could research this up, down, and sideways, but by the fact that carbon dioxide enables almost immediate reactions at that cellular level and interacts with fermented components of plasma and proteins and carbohydrates to form, active carbon dioxide. And this, when you think of it from even a science experiment, this ensures the normalization of pH in tissues. Interestingly enough, I
Wait, let
had
me let me just say one thing though, that yes, some of the initial results we were seeing were injected carbon dioxide, but it turns out that you can achieve the same results just with this mask that's applied externally, not injected.
not injected. Right,
Not
right.
injected.
Not injected, of course. The method the method
Non-invasive.
of delivery has changed since 1930, and that's what makes this particular product, CO2 Lift, so unique and sustainable. Now, how does CO2 Lift fit into the roadmap of a procedure, and why does healthy skin respond better?
So healthy skin responds better just because all of the functions of the cells are working to their optimal to they're working optimally. And the way that we use the carboxy mask is we apply it, as I said, we apply it immediately following a laser treatment because it's going to accelerate healing, reduce any swelling, any inflammation. And the other times we use carboxy mask is following a treatment several days for the next week or so, because once again, it's going to reduce any side effects. And then sometimes we just use the carboxy mask before people go to a big event or to a big conference or something. I did one the other night because I'm going to a dermatology conference this weekend.
And that's why you are fabulously glowing. Now, CO2 Lift Pro, I had that done in a doctor's office as a medical monotherapy. I found it to have been extremely effective. It was great. I had really dry skin, and it really, the speedy healing of wounds, the speedy recovery, that's what got me the most. I used it on my explant scars after my explant surgery 3 months ago, and it's been extremely effective, even as an aesthetic monotherapy. Now, the founder of CO2 Lift has praised your ability to think outside the box. Can you give an example of how this mindset has influenced your approach to dermatology and skincare innovations?
Well, absolutely. I would say that one of my specialties has been that there's no problem too big or you know, there's nothing that's you can't tackle in one way or another. Whether it's scars from an accident, from I've treated scars from airplane crashes, from bird bites, from car crashes, or whether it's just trying to figure out what's the best way to contour the face, to address asymmetry, differences in the face. And so the way that I found the best way to do it is to layer all these treatments to figure out which laser is appropriate for which issue, and in the same by the same token also which filler is going to be the right one to use in which area of the face, and also which wrinkle relaxer, because there are a host of each of those. But there's one thing that I always use now, which is the carboxy mask, the CO2 lift mask, because it's remarkable how it changes the skin, and so quickly after 45 minutes of using the mask.
I couldn't agree more. Now, are there any specific conditions or concerns that you find carbon dioxide therapy for the skin to be particularly effective for?
Carbon dioxide therapy for the skin is particularly effective if you've had a burn. So let's say you even have accidentally you got a sunburn. It's outstanding for that. Or the laser you were treated with was a little too hot and you've got some persistent redness. Then the carboxy mask is excellent at that. We know from studies that using carboxy mask on diabetic ulcers, which of course are very difficult to treat because the small vessels in diabetes can be very damaged. And so that's why those wounds on a diabetic leg do not heal. So we see that applying this mask to people with diabetic ulcers accelerates. I mean, it allows those wounds to heal, as well as people post surgery, like you mentioned yours. But in a lot of surgery for skin cancer or other types of cancer, a flap is used where you bring one part of the skin over to another side. And so this particular flap may have a compromised, like the blood supply may not be enough. And so the carboxy mask can help restore that blood supply and reduce healing time, especially useful in breast cancer surgery when oftentimes the nipple is moved and there's risk of the nipple actually, the tissue not living. And so
Necrosis, right?
there's necrosis. And so this can absolutely prevent that from happening.
I started using it on my nipples immediately after surgery. Now, it's science, right? It increases the presence of wound repair factors and growth factors, which then help cells turn over faster and reduces the appearance of aging and scars and stretch marks and so much more. I love it for all of the reasons you just stated, stimulating collagen and elastin production, which then promotes elasticity and helps retain hydration, improving local metabolism and elimination of waste products, which then helps the body heal localized damage such as scars or acne or even hyperpigmentation. I couldn't endorse this product more, and you are part of many experts and surgeons and top dermatologists in your field that are really swearing by this. Now, how do you envision the future of non-invasive dermatological treatments evolving over the next few years?
I think the future is very bright for non-invasive treatments because if you think about it, surgery to correct aging is really kind of crude and filled with risk. You can risk damaging a nerve if you're cutting into the face. You may not be it may not the results may not be exactly what you want. And also people think that plastic surgery is forever, but it's not. It only lasts about 5 or 6 years max. And so then a lot of the signs of aging start to appear again. So the idea of using of the all of these technologies improving over time, the tissue tightening, the muscle stimulation, the way the fillers are integrated into the skin, different types of lasers to address brown spots, fine lines and wrinkles, red spots, and also skin conditions like rosacea and eczema and acne scars. That's a wonderful use, a wonderful area to treat very effectively. So everything is on the right track to improving and becoming more effective.
Love the narrative. Now we have 2 minutes left and two questions left. Okay, here we go. Your top three tips to slowing down the aging process.
Okay, well, sunscreen, of course. Using something in the retin A category, in the tretinoin or the retinoid category every day, small amount, following with hyaluronic acid. And lastly, paying attention to all those things that we think, we don't really want to care about, which is nutrition, fitness, sleep, meditation, quality of life, because all of that really contributes to healthy skin and healthy aging. Because it's not so much about aging, the number doesn't mean that much anymore. It's really about living your life no matter what your age is. And you need every single factor. You want to look good too. That's just as important. That totally falls under the wellness umbrella because we know when we look good, we feel good. And that's hardwired into us.
Amen to that. Now, as a dermatologist, okay, complete the sentence. I would never list three things.
Have a blistering sunburn. um, I would never forget to take off my makeup because pollutants are stuck to it. And I would never stop doing all of my anti-aging treatments, which includes all of the wrinkle relaxers, the fillers, the lasers, the tissue tighteners, because I know that at my age, which is in my 60s, that I want to look this way in my 80s. And we have so many ways to do that because when you look good, you feel good.
Oh, well, you look beautiful and you are glowing. And thank you to CO2Lift for that. Well, thank
Yeah,
you so much
exactly.
for coming on, Dr. Ava. You are amazing.
Thank you so much. My pleasure. And CO2 lift for the face, neck, and there's a CO2V for the vagina as well. For people who have had breast cancer, can't take hormones, it's incredibly useful there as well. I wanted to throw that in. But yes, I should have
I
mentioned
love
that
it.
as my essentials. Yes, and CO2 lift once a month. Rain or
Yeah,
shine.
I love it. Vaginal rejuvenation. We're here to demystify sexual stigma and really, vaginal rejuvenation is at the forefront of that narrative. Well, thank you so much once again. That was our Going Deep segment brought to you by CO2Lift, and that was the incredible Dr. Ava Shamban. You can head directly to avamd.com, or you can check them out at skin5.com, and on the gram, Dr. Ava Says, or at AvaMD. You can also check them out at Skin X5. You're listening to a moment of Zen right here on 710 WOR, the voice of New York iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2Lift. CO2Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase increase luminosity, and improve pigmentation, sagging, skin tone, and radiance. For more information or to order CO2 Lift, go to CO2Lift.com.